You hear sometimes patients say, well, my doctor doesn't talk to me. What they really say is, my doctor doesn't listen to me. When patients come to see a neurologist, they are almost always terrified. They've had a stroke, or they've had a seizure, or they've been told that they have Parkinson's, or the family is bringing their mother in thinking she has Alzheimer's. In that time, there's a whirl of emotions in their mind. Fear, grief, and if you go out and touch them, physically touch them, shake their hand, sit them down, look them in the eye, introduce yourself. Hi, I'm Dr. Morgan. And they'll tell you your story. And when they quit talking and you haven't interrupted them, their anxiety level has gone to nothing. And then you can communicate and go about the business of decision making. But you have to deal with the emotions first. When someone is in turmoil and terrified, the communication is to listen to them. Doctors need to do that. You've touched them as a human, and then your partners. That's what we need. Listening is hard work. Stroke is a huge problem nationally. I give talks to community groups around Oklahoma and Oklahoma City about how not to have a stroke, stroke prevention. And I say, stroke is the third leading cause of death in the United States. Doesn't scare them at all. Then I say, stroke is the most likely thing to disable you and not quite kill you and make you dependent on your family for your needs. Then you have their attention. Stroke is an abrupt event. One-sided weakness, right arm, leg, face. Sudden loss of speech fluency, or sudden loss of the ability to see half the world. Southwest Medical Center is the best survival data of any hospital in Oklahoma. And that's because our stroke unit, our stroke program, our board of directors decided we're going to do that. And I'm proud that Integris is led that way. Trust in healthcare, to me, has to do with the leadership at the top, making decisions based on what's best for the patient. I had my wife in our hospital, barely clinging to life for a month, with complete trust that all the decisions made for her would be in her best interest, knowing that she might die any time. And we're not in charge of that. I've worked in Integris for 30 years. The best way to earn trust is to deserve it. The leadership of my hospital deserves trust. At the end of the day, there's you and there's the patient, and you're comforting that person. But trust, to me, is every decision is made in the best interest of the patient and family. And that's the way it works in our hospital. When I had a heart attack, I remember sitting there with crushing pain, having trouble breathing. I could look at the monitor and I could see that my pressure was going down. So, next stop is heaven. And then the clot dissolver worked. And when it worked, that quick, pain went away, pressure came up. Amazing to be aware of all that. So it's a joy now when a 25-year-old comes in, unable to speak, paralyzed on one side. I give them a drug and they get back to normal. Amazing. It's amazing. And then a week later they're working and it's like the world is new to them. That never happened earlier in my career. Because I had received a clot-busting drug, TPA, that saved my life, I was very eager to champion using that in Oklahoma City. Nationally, about 2 or 3% of stroke patients get TPA. Our hospital runs about 19%. We want to be the hospital where you want to come if you have a stroke so that you can get the right thing done. It makes you way more alive. Cars aren't important, houses aren't important. Touching someone's life is important. A singer named McGraw came out with a country and western song. Someday I hope you get to live like you were dying. Once you've been dying and you come back, every day is a gift. You just don't worry. Time spent worrying is just the biggest waste on earth. Enjoy your family and enjoy your friends, and don't worry, go live your life like you're dying.